I'm going to try to draw together a couple of strains of thought that I think we've been hearing today. And these all have to do with how we conceptualize the issues or how we frame the issues. So I'd like to have us think not about conflicts of interest, but about relationships between academia and industry. And to have our discussion be risk-based and to start to sort through the kinds of relationships that really pose an unacceptable risk to the integrity of science, the rigor of the research that's done, and thereby sort of thwart efforts to develop effective new drugs. So it needs to be a risk-based policy. The second thing, it should also be benefit-based. We shouldn't just talk about the risks of these relationships. We should talk about the potential benefits in terms of our goal of developing knowledge that leads to new treatments. Third, our whole thinking about these relationships and the policies we have to deal with them needs to be evidence-based. We need to think of ways to identify those relationships that really facilitate the innovation we're looking for, and those that really undermine the rigor and integrity of the research, and focus on the outliers. Finally, I think we need to have the way we disclose these relationships. We need to think about how to make those disclosures in a way that facilitate the identification of, on the one hand, the high benefit, low risk relationships, and on the other hand, the high risk, low benefit relationships. Right now, I think the way we're going to go about disclosure, we're not going to be able to distinguish between those relationships that really help foster creative innovation. And we've heard some talk about other kinds of relationships. Well, I actually think that, and I've heard some other people, I think Alan, you said this, that promotional speaking to help increase sales of a product isn't the same kind of relationship as entering into a true scientific collaboration that's knowledge-based and knowledge-driven. And unless we're willing to say there's some relationships we think are really vital to innovation that helps to provide effective therapies, and there's some that aren't so vital, and we need to say, maybe we should stop trying to defend those with the same vigor we defend the high benefit ones. So I think we need to reconceptualize, we need to gather evidence, and to make our policies based on evidence, and we need to make sure our disclosure is aligned with the goals we're trying to achieve.